Hafaday and good morning to everybody. Thank you so much for being here. I want to welcome you to the Guam Congress Building. I want to thank SDA for allowing Dr. Neil Nedley to come and do a presentation. I was speaking with Doc earlier. I told him that I first saw this on that big giant LED screen up in on Marine Drive, and so it was very attractive because it was a bright blue color, right? But then when Carmen and our staff were talking about this and about the specialty that Dr. Nedley is concentrating on, which is depression and anxiety. I thought it was something very important for us as a community to be able to listen to and learn a lot from. And so we've taken a recess from our session. This is being broadcast live on our legislative channel, but it's also something that is being recorded so that we can provide it to the community at a later time for them to be able to take advantage of this very important presentation. So, Doc, I want to welcome you to Guam, welcome you to the Guam Congress Building, and thank you for allowing us, for making time to present this to us here today. Thank you very much. And ladies and gentlemen, Dr. Neil Nedley.
Thank you very much, Senator Rodriguez, for the invitation, and it's been a real privilege to be on the island of Guam. And depression and anxiety is unfortunately increasing not only in the U.S. mainland, but also in the U.S. territories, including the island of Guam. In fact, I was just having a discussion before coming here with your governor, and he was telling me about how the economy has significantly improved since 2011, which of course it is true on a number of fronts. But as I was telling him, depression and anxiety has not improved along with that. And normally we see a relationship when the economies get better, normally mental health can get better, because mental health can sometimes be a challenge and a problem due to the financial distresses of life. But despite the fact that economies are going up and unemployment has gone down to 4%, we're not seeing the usual commensurate drop in depression and anxiety. We're actually seeing it go up further. And we also have seen suicide rates at an all-time high, not only on the U.S. territory of Guam, but also in the 48 states. Although here in Guam, it's 50% higher than it is even in the 48 states. And so I think it's timely for us to discuss this issue today in Guam and see what we can possibly do that maybe is different and more progressive in regards to reversing this illness and doing what we can to eradicate it. I think I do have a little slide presentation here. I wanted to go over a little bit about the details of the human brain, because when we're dealing about depression and anxiety, we're really talking about the brain. And the brain has an amazing ability to change. That's one of the great things about the brain. What we have found is you might have severe depression and anxiety today, but within 20 weeks, it can actually be completely eradicated. And that means even utilizing the cure word, which for a long time we were reticent in utilizing, but it is possible for that to occur. I might need to, let's see, I think that's going to do it. Most complicated structure ever investigated by science. Over 100 billion nerve cells. I might need some help there in the back because I'm not sure our clicker is working. What's that? Oh, there's a delay? Okay. You can't even count the number of nerve cells that you have in your brain if you did that full time from the time you're born until the time you die. There's even more supporting cells known as glia or structural support cells. And then what sets it apart from the rest of the body organs are the thousands of different types and categories of cells that are there in the brain. The heart, for instance, is a very complex organ, but it has only 24 different categories of cells. The liver, about 25 different categories of cells. We can't live without either one of those organs. And of course, we certainly can't live without our brain, but the brain is even far more complex than those organs. And what every pharmaceutical company is trying to do is affect this area of the brain where the connections are. And if we were to add up those connections, what we call the synapses, there's 500 trillion of them in just one 2.5-pound brain. That makes even the US national debt seem like a small number in comparison with the amount of connections that each of us have in our human brain. And of course, these connections are different neurons, different chemicals, different receptors, and we have isolated that a number of these chemicals and receptors are very important when it comes to depression and anxiety. Now, depression and anxiety, of course, is a biochemical condition in the human brain, but it's not just a biochemical condition. With the rapid rise that we've seen in depression and anxiety, and let me just give you an idea of the rapid rise, particularly in our younger age group. Dr. Berenson, he's Harvard top psychiatrist. He's the director of the Center of Young Healthy Minds at Mass General Hospital. And he tells us 60% of college students today have a diagnosable mental illness. 60%. That is far more than what we've ever had. It used to be 5%, then maybe 7%, 10%. Now we're 60%. And of course, that includes depression. It includes anxiety. It also includes substance abuse and addictions that are just causing a lot of dysfunction. It also includes academic underachievement, learning disabilities. When you add all of those things up, we're talking about 60%, and now it's the #1 reason why college presidents lose sleep is the mental health of their students. And so really there's only two categories of people: those who know someone with a mental disorder, because it's so common you have to know someone with a mental disorder, or those who have a mental disorder themselves. Now, sometimes I've said, or some people have told me, I forgot about a third group, and that is those who cause others to have a mental disorder. But if you're in that group, you actually have a mental disorder yourself. And so those are the, really it boils down to those two. Going on, the financial cost of depression. And you know, one of the reasons why we don't have the full legislature here today is because of financial concerns at the legislative level and at the territory level. And these financial concerns are brought about by no fault of anyone here on the island of Guam, but we still have to be able to pay for things. And you know, in the United States, we have this continual war. If you've ever watched CNN and then watch a news program at Fox News, you see very different presentations that are going on. And you see one group that is saying we need to raise more taxes, and then we have another group saying we need to cut expenditures. But I haven't really seen either group acknowledge the fact that at least in the mainland United States, it may not be this way in Guam, but in the mainland United States, we wouldn't actually have to do either one of these if we would be able to make a significant dent in decreasing depression and anxiety. Why is that the case? Because people that have major depression are 7 times more likely to become unemployed. There are significant financial consequences to the government, and when unemployment occurs, of course, they're not making wages, and when they're not making wages, what else are they not paying? They're not paying taxes. And so the revenue side goes down, and the expense side goes up. And really, the solution to this is not as complex as we might think that we'll get to. But the cost of depression, if we could go through that. If you are working, you're losing about 6 hours on average of productive work per week if you have depression. 80% that are working are impaired in their daily functioning. Less ability to concentrate, lower efficiency, less ability to organize their work. And in addition, if we could go further, it's the #1 cause of disability. And this is now becoming worldwide. It's not just in Guam or the 48 states, but people are more likely to lose work during their productive years due to depression than any other single illness. And of course, that pays a significant toll. Over twice as likely to take sick days if they are working. In one study, the cost of absenteeism was directly related to taking antidepressant medicine. What does that mean? If they were being medicated for their depression, they were actually more likely to lose work. Now, one of the reasons for that can be one of the side effects of common antidepressants, and that is they cause an I don't care attitude. It's kind of pervasive, and many people kind of like that side effect because they're having crying spells, and they're wanting those crying spells to go away, and so they really kind of want not to care as much. But in reality, although those drugs do help crying spells, and they can help these feelings of deep sadness, they can actually cause you not to care about things that you should care about. And so it's like, who cares? I don't feel like going to work today. Someone else is going to have to handle that. And so you're actually even more likely to lose work. And as mentioned, depressed people are more than 7 times likely to become unemployed. And then the long-term effects during childhood and the financial effects, if we could go on from there. Children were followed for 40 years to determine the effects of illness and psychological problems on their life chances. And if we could go to the next bullet point, 7 fewer weeks of work per year, a loss of 35% in lifetime income, and a lifetime loss for each family who has a depressed family member of $300,000. This is no small toll to the family. So it's a lose proposition for the families. It's a lose proposition for the person who's suffering from it. It's a lose proposition for the government side of things. It's a lose proposition for the corporate side of things. But yet we seem to, unfortunately, we seem to be acting like this is just normal because we're not really even talking about it that much. And really, this should be front and center. You know, I'd like to see emergency legislative meetings held all day or all week about what we're going to do about this sometimes, instead of just about, you know, the more superficial things, because if we can solve this problem, it can cause a whole lot of benefit. It's a win-win for everybody across the board. Going further, personal loss, if you are working, of $10,400 per year of income by age 50. That's a significant amount of money that you're losing. And that's why it's worth investing. It's worth, if we are truly going to be helping mental health, it's worth an investment in regards to mental health, because we've had so many people, once their depression and anxiety is eradicated, they're making even more than that the next year. Not only do they go back to work, but their boss recognizes their emotional intelligence, they're managing their emotions, they have leadership skills, and they start being asked to rise that corporate ladder. And so they're making so much more money as a result of not having to suffer from these illnesses. So the total cost in this one study, $2.1 trillion, which does not include the increased cost of medical care that all of us must assume. And so that was just a select group that they were looking at, but you can see how our trillions of debt could actually be reversed if we were able to make a significant dent in this epidemic. And right now, because it's an epidemic, it looks like things are going to be getting worse in regards to these lines instead of improvement. And so let's take a look at I'm not going to go over these symptoms. This is the diagnosis of depression. If we could maybe skip ahead to the next slide. These are the 9 symptoms of major depression. You have to have 5 of 9. Depression would be bad enough if it did those symptoms, but it's actually the 9th leading cause of death in the U.S. And we don't often think of depression causing death, but suicide, obviously, the most likely cause for it is depression. but then it also causes other illnesses. If we could go through that slide very quickly as well. I'd like to get to where the Nature magazine article a few years ago, and keep going, about suicide. By the way, 1 million suicides every year. 1 million. That's large cities being wiped out. And this is something that, you know, if we had 1 million people dying every year from commercial plane crashes, do you think there would be an uproar? Absolutely. But 1 million people kill themselves and hardly anything is said about it. Yes, we do say something about it when there's homicides of people being killed, and we have public outcries in regards to that, as well as we should. But for every homicide in the United States, there are 2 suicides. So if we're going to have equal time, we should be spending double the amount of time on this issue than in regards to the homicide issue. It's the 3rd leading cause of death now in young people ages 10 to 24. Let's keep going if we can. As mentioned, twice as frequent as homicide. But then let's go into the research. A few years ago, Nature magazine came out with an entire issue on the subject of depression. And Nature magazine is thought to be one of the most 5 prestigious scientific journals published. And so for them to come out with an entire issue on this was, of course, groundbreaking. And they mentioned how depression is going up in every country of the world. 6% of the population currently has it. It's the #1 single most common mental illness. They did talk about the 1 million suicides each year and how this is going up. If we could go to the next one. They talked about it being the most common cause of disability. Look at that figure, 76 million years of work loss during your productive years, more so than any other single illness. More deaths due to depression than lung cancer. And lung cancer is a major cause of death in our world today. But you're more likely to die from depression than lung cancer. And unfortunately, this is another sad statement they made. If you do have cancer, you're actually more likely to be cured from cancer than you are depression with the traditional therapies available today. More likely to be cured from cancer. And we know cancer cures are not where they should be. You know, it's the 2nd leading cause of death in our society, but yet our cure rates for cancer are better than they are for depression. And Nature magazine said, this is unacceptable. We've made advances in cancer therapy. Why can't we make advances in regards to depression and anxiety therapy? And yes, the drug companies have come out with more drugs. They've come out with, you know, there's about 70 of them now that can be utilized. And we've had patients come to our program that have been on all 70 of them and still have failed. But this is what Nature magazine told us regards to the drugs. Notice this is a quote from them. 5 decades of work on antidepressant drugs have not made them more likely to lift people out of depression. Medications and psychotherapies help some people with the disease, but notice the phrase they use after that, they fail many others. And so we have many people with what's called treatment resistant. They don't respond to medicines at all, and if they do respond to medicines, it's not eradicating or curing the disease. Nature magazine went on to say, in a study conducted in real clinical settings, a common antidepressant produced a response in just under half of the participants and achieved full remission in only 28%. And that's what happens in the real world clinical settings. Failures to improve efficacy reflect continued ignorance of the molecular mechanisms of depression. And so they said, we must go back to the drawing board. And we must start looking at new approaches for treating this disease because we can't medicate ourselves out of it. So within 3 days of this article being published, and you can see the date here, Dr. Ramirez and myself published an article in the American Journal of Lifestyle Medicine. And it's not coming up on the screen. Maybe we can see it there. There you can see it. And it actually went into the causes of depression. It turns out I was the first one to look comprehensively at all of the potential causes of depression. And I can tell you that when I got to cause number 71, I began to get depressed myself because I wasn't through yet and I didn't know where it was going to end. But after I got to over 70, I started to analyze them, and I realized they could be categorized into 10 different categories. We ended up describing over 100 identifiable causes of depression. What happens in the typical world is depression is diagnosed, and then immediately a medication is handed for it. Instead, we need to have a paradigm shift. When depression is diagnosed, we need to start looking for which of the 100 causes is behind it. And what we can do is we can reverse most of those 100 causes and thus eradicate the disease and produce a cure. And so this looked at the statistics in thousands of patients. It looked at which categories of causes were there, and we found out the brain is pretty resilient. The brain can undergo a single category of causes of depression, and you won't have depression or anxiety. It can undergo 2 causes, and you won't have it. It can undergo 3 causes. You won't have it. Our brain is pretty resilient. It can compensate for certain things. But once a 4th hit or a 4th blow occurs, that's when depression or anxiety starts to manifest itself. And it will manifest itself in every brain. Some people's brains, they think, I haven't had depression my whole life and I've had lots of problems, I'm resistant to it. No, you get enough causes in there, and it's going to happen to you too. And so once we are able to identify that, what a difference it makes. Now this is going to require, I think, a paradigm shift. We've had, let me go forward here a little bit. These are the 10 different categories. We won't go into a lot of details, but these are categories that we look for when we see a patient with, if you could back up just one, when we see a patient with depression, we're looking to see which categories are active. We will look for the genes. We'll see if those genes are turned on. Developmental causes has to do with how they were raised. If it's a dysfunctional family, if they've had sexual abuse, which is also at an all-time high in our society. Lifestyle causes are not being on a regular exercise program. Circadian rhythm has to do with sleep-wake cycles, which are also important. Addictions, which are also at an all-time high, even here in the island of Guam. And then there's nutritional causes. In fact, the scientific literature is very clear now in regards to mental health. Nutritional medicine review articles from Europe and the United States both state that should be considered mainstream treatment in psychiatric practice, because there's certain types of brain chemical issues that are much better solved with nutrition and nutrient supplementation than by medicating with potential adverse side effects. Toxic causes, social, complicated stress or grief, other medical conditions like thyroid or autoimmune disease or traumatic brain injury, and then frontal lobe causes. This has to do with the front portion of the brain, the analytical portion of the brain. So when someone comes to us, we actually administer a test called a depression and anxiety assessment test. It's a standardized test that we've helped to develop that can highlight right away to the practitioner which one of these are active so that they can start working in the right direction to reverse those causes. Research in the last 15 years through SPECT scans have showed us that one thing that's characteristic of virtually every depressed patient is a suppression of the frontal lobe of the brain's activity. And if you could do the next click there, you can see this person with depression. The top of the brain is where the frontal lobe is at, and it's like a Doppler weather radar. The hotter the color, the more active it is. And now this is the same brain after they've recovered from depression. Notice the marked improvement in circulation in the front part of the brain. This part of the brain tends to be largely neglected in psychiatry today, but we're finding out it's one of the most important aspects. And so we must address the frontal lobe and not continue to ignore it regarding mental health. Now, I'm going to probably not go through all of these slides. You could go through a few more. These are some of the published studies that we've done on another approach for depression called a mental health education approach. And this is where it might require cooperation of us all in regards to this paradigm shift. The approach that I'm outlining here has now been done in 7,000 patients from all ethnic backgrounds on 5 continents now. And this study of 7,000 people shows that if you have clinical depression or anxiety, the response rate of this 8-week educational program, and how much investment is it? It's 2 hours a week, once a week for 8 weeks. We are educating the person with depression and anxiety how the brain works, how brain chemistry works, and it's a comprehensive approach. One night we'll deal with one of those hits called nutrition. Another night we might deal with genetics. The next night we're going to deal with lifestyle causes. The next night we're going to deal with circadian rhythm causes. The next night we're going to be dealing with frontal lobe in regards to how you're thinking and how you can actually change your irrational thoughts and catch them into rational thoughts. And it's done by trained facilitators, trained directors, and this is an approach that costs less than $200 most of the time. So it's about a month's worth of the drug Abilify that insurances would cover. But the response rates are 85%. That's higher than what you'll get in virtually any other approach. Now, it doesn't mean it has to be either or. They can still take medicine. It's not an either or approach. They can still see their physician and get a workup to make sure there aren't any other medical conditions. They can still see a psychotherapist to help them with their rational thoughts. But it's just an add-on that has been shown to actually decrease something that is harder to decrease in virtually every psychiatric patient, and that is the benzos. These are given for anxiety because they help you feel good, but then they make your anxiety tenfold worse if you try to get off of them because of the dependency aspect. But once we educate the brain, educates the person in regards to lifestyle habits that can change their brain, they're able to much more easily get off. And you can see those before and after differences in just 8 weeks of getting off the benzodiazepines. This was published in the Journal of Addictions and was presented in Florida several years ago. We've also taken a look, and once again, you can see the baseline and where they were in 8 weeks. It was quite a marked difference in hundreds of individuals of the 7,000 who were taking these drugs on admission. We've also taken a look, if we could continue to go on, at even medical causes such as hepatitis C. And we found out this program works very well for hepatitis C patients. Going on to more slides, this was presented at the Digestive Disease Conference in 2015. It was published by the journal Gastroenterology. We also have done studies on a lot of different subsets, and I won't necessarily bore you. You can go to a tab called Research on our website and see all of these different studies and where they've been published and all the different subsets that are there. And I'm not saying that this has to be the approach. What I am recommending, however, is that we start looking, instead of medications and surgical approaches, which is what insurance companies primarily cover, diagnosis, medications, surgery, but typically they don't pay for education. Maybe if the doctor's doing education in the office, that'll be part of the visit. But to actually have a formal educational program where you're going to have a completion and a certificate and accountability, where you have facilitators to make sure that they're going through insurance companies in general have this statement: we don't pay for education, you have to pay for tuition. But if it actually saved them, which it will, on the other end, it would be a win-win. It just requires a different way of thinking about this illness and disease. And it would be a win-win for governments, it would be a win-win for the patient as well. And so, but if you're going to do an educational program, you want to make sure it's been studied and it's been published and that it's going to produce reproducible results in different ethnic groups and different avenues and those sorts of things. The post-program comments are pretty amazing. Comments that you won't see when people are taking more traditional therapies. And of course, the response rates are significant. And of course, we do have another approach as well. What happens if they don't respond? What if they're the 15%? We always want to have as many people respond as possible. And we've looked at that group. And if that group who doesn't respond to that program comes to a residential program that is comprehensive, where the educational part is not only being performed, but you're having added accountability. For instance, we have a residential program for the most severe forms of depression and anxiety. The circadian rhythm light box is no longer an alternative. It's something that they're going to have to use. They're going to, at 5:30 in the morning, they're going to be up. We feed them the food that's going to be the best for them. Yes, they're only there 10 days. It's a 20-week program, but they feel so much better in 10 days that they're able to continue this on. I'll just give you an example the other day of a phone call I got from an insurance company in the Northwest. Again, since insurance companies don't tend to pay for this model, it's not a psych hospital, you know, it's a residential program. They're at more of a spa-type center, but they're getting the education. We have licensed therapists, licensed physicians, licensed counselors. We have a very complete staff. But the insurance company called me and says, we've had 4 of our patients, we've looked at them, go through your program. Severe forms of depression, anxiety, suicidal thoughts, the whole bit. And your program is amazing in what has happened. They're not only doing better, they're back to work, they're not costing us money down the road, they don't even need more counseling after 20 weeks. We teach them how to become their own therapist. And they said, the other program that we would use for our tertiary patients cost us $45,000. Yours was under $10,000, so we want to pay 100%. We want to pay their plane fare to get to you, and we want to pay a companion plane fare to get to you as well, because it's a no-brainer. But we want to have priority to have your spots, because we have limited amounts of spots. That's our problem. We need to now expand and go into other cities as this is going forward. But it tells you an educationally based approach where you have accountability as part of that education can produce a paradigm shift in mental illness and can make all ships rise. And so whether it's our program, whether you find another one that might do just as well, I don't know of one that's out there, but you might find one, we want to be able to recognize that mental illness is due to what we put into our body and what we do with our body and how we think with our brain, and it's what we repeat over and over again. That's how the brain changes, and it can change for the worse and it can change for the better. So if we can educate the person in regards to what they're putting into their body, how they are utilizing their brain, we can make a tremendous difference that is far superior to the traditional means that we have been utilizing to treat this disease. And we can also help get rid of the stigma that's out there, which is one of the other big areas. I can tell you there's less of a stigma in the younger age group because depression and anxiety is so rampant. They don't mind telling people, I've noticed. It's the older age group, over 30, that tend to have more of that fear and stigma. But we need to recognize we can also come to this. It's something that can happen to all of us. And fortunately, there is a way out. And I wanted to just present this opportunity for us really coming together to find a better and a low-cost approach that can possibly do far better than what we've done by throwing often unlimited amounts of money. There's a reason why Obamacare didn't cover mental health that well. And the reason is because it seems to be a bottomless pit. You throw a lot of money at mental health and you don't get the results. This is something where we have found you put a limited amount of money and you can get a lot of results. And it seems like a no-brainer that people would buy onto it, but you know, sometimes familiar things happen and mankind does not bother about it. And that's why it requires some awareness and us being all educated to be able to take a different approach in regards to these two major illnesses that are causing so much problem. Are there any questions about what I've presented? Any comments about it? For those who want more of the slides and the research, you can go to our research tab. You could also go to our website and see a lot of the comments that are there. I'm sure there's some of you that might have a question, and if so, I understand this microphone here is the place to ask it so you can get it recorded in. So if you would come take a seat right here, and then we will we'll move forward.
There's a lot of people that are military dependents and the veterans. Would this be an approach for you to?
Yes, absolutely. We've had many veterans go through our program, and the military is also very much looking at it right now as well. I can just tell you, in the U.S., there are 20 veterans a day that end their life. 20 suicides a day just from the veteran population. And the military suicide rates, even on this island, are high. And a lot of this is occurring in the military as well. So there's even probably a greater need for that segment to get educated.
Okay, so I know you'll be addressing, or you've already been addressing, with the military dependents. What about the dependents? Is this something you can bring towards, you know, for the, not necessarily the active duty, but the dependents?
Right, exactly. The families of the military people who often, you know, we focus in on the military, but their families suffer as well as a result of this. And yes, we would certainly be open to doing that, you know, if there was a desire on the part of the military officials for us to get involved in regards to a more corporate education that can involve the family as well.
Thank you.
Thank you.
Doc, I want to thank you very much for your presentation. I'd like to ask, have any Guam patients taken advantage of this program already?
Yes, we have had Guam patients that have come through our residential program, and we've also had, there has been one time that the mental health education program has been conducted here at Guam. And I'd have to go back to see how many people, but we would have a database of that. And we could, if interested, we could at least share you the results of that. The medical clinic is being trained, and some people are being trained to facilitate additional programs, and they're going to be rolling out a program in May for some Guam individuals. And so there is a start that's starting to occur here in the island of Guam, and I'm encouraged by that.
What do you think it would take for Guam to have a holistic approach to mental health, because it doesn't have one now?
Well, I think one of the things that it would take as well is our insurance companies that are in Guam to have a willingness to actually pay for the comprehensive approach. You know, I was talking to the Guam clinic yesterday, and one of the physicians was saying, you know what, even though it's cheap, it's less than $200, a lot of our mental health patients that are unemployed, they can't necessarily afford that. But if insurance was willing to do that, I can tell you if there was a new drug that had an 85% response rate, if it cost $400, the insurance would pay for that. They might not pay for all of it, but 80% or something like that. But the fact that it's a mental health education program, that's where the block occurs. And so if we can get beyond that block, it would be much more accessible to the patient population.
Dr. Nedley, thank you so much for coming out I'm sure it's a difficult schedule. Senator Rodriguez, thank you so much, and the other legislators for dealing with this problem. I'm sure it's caused tremendous stress. So experientially, they know the issue. I really feel we need to address the problem of mental health. For myself, I think the history of Guam, which has included, the overtaking of powers, the Spanish, the Japanese, and then our young men and women going to war, and they come back with problems. So we've ingrained a lot of probably frontal lobe, negative emotions, negative way of thinking. On top of that, our island is very toxic, both from natural war waste and our toxic, and also our farming. And I like to throw in a word for farming. I think the other part of dealing with our mental health depression is chemical pesticide-free produce, and that people really should start growing their own as well as eating chemical, toxic, pesticide-free foods. And so we need to do that. So on top of that, farming needs to be encouraged. But I also know for those of us in healthcare, we kind of go through post-traumatic. I mean, it's stressful to go in and see people sick, they never come out, or we prepare them for burial. So I really feel that when you put the power, the decision back into the consumer, it will work better. Also, from the clinical aspect of healthcare, it is usually unlikely that you would get health education because it doesn't fit in the time frame. So I think if the insurance companies see it worthy, personalized health education where the person takes responsibility, I think would be very helpful. I know for myself, I'm a nurse by profession, the fact that I know this and that does not mean my health behavior changes. I have other issues like genetic. I was born after the drop of the bomb. I have I come from a single parent family. I just stress after stress. I was a caregiver, and so I've had all the arrays of diseases. So thank you for taking the time. I'm reading your book. It's fabulous. I think every clinic, even the insurance companies, I'm even thinking of giving a book to somebody I know at the university who's in sustainable agriculture as well as childhood obesity, because I really feel obesity is a sign of depression very young. Thank you.
Well, thank you. And you make some very valid points. I've stated for a long time that we're not going to solve the obesity epidemic in our country until we solve the mental health issues behind it, because people do self-medicate with food, and there's comfort foods. And so as we improve the brain chemistry, we'll be able to improve that. But you're right about toxins as well. They can play a significant role in all of this, as well as the foods that we're eating. And so, and that's what a person will learn about when they go through this educational program. One of the reasons why we recommend it be a group program is because you can have some group accountability. Why we have trained facilitators and directors is so we can provide that accountability in a loving, compassionate way, in a non-judgmental way. And that's what our facilitators and directors are trained to do. And so it's not just the material itself, it's how that material is delivered and how it's applied on the local level, and how we utilize that loving accountability to be able to produce some real behavior changes that can change our brain for the better. Thank you. Anybody else? Yeah.
Thank you again. I just wanted to ask, because how can you get your clinic open here in Guam?
Okay.
I know you've addressed it before, but could you explain one more time?
Okay. Now, I think what you're talking about is in our clinic is for the most severe forms. This is what we call a residential depression and anxiety recovery program. And by the time they come to us, we're the last stop. They've been to behavioral medicine units, they've been to psych units, they've had their shockwave treatments, they've had their esoteric kind of extreme measures being utilized and still not having satisfactory results. And then they come to us and they find out about this approach. And so it does require a team that is well trained to produce this. And I'm certainly willing to start the process in regards to this in Guam. But as I explained in another setting, we'd like people who are on the professional side of things to have been intimately involved in the educational program first, because they'll gain a lot of experience that way, and they'll be able to, it'll be much less of a learning curve when they come to us for training. There's also a few other requirements that we would make sure that they fulfill, but then we are actually willing to take a whole group from Guam, bring them over to Northern California where we run our clinic, and actually be an observer while we teach for a couple of those programs. Normally it's going to take at least 2 programs once you've fulfilled all of your educational requirements before that. And then we would come over to Guam when you run your first program, and we would be in the background as the professionals are running that program to make sure that the quality is maintained. But we would welcome that. I think there would be a lot of interest to have it here in Guam because, as far as spa locations are concerned, this would certainly qualify. We'd have to find a facility that we could lease that would be appropriate for all of this, which would be the lesser of the problems. The main problem is to get the staff ready and trained. But it normally takes about 20 staff members to deal with about 20 patients that come through that program. And then some that are there for follow-up as well, because they're not just there for 10 days. Some of them need to stay longer, by the way. Less than 20% will need to stay longer. But we also supervise them for that 20 weeks, and so our staff is involved in that as well.
Hi, my name is Dr. Galgo, and I just arrived from the mainland. I was living in Los Angeles, California for a number of years. I was practicing as a dentist for the inner city kids and for the community there for a number of years. And although I'm not from Los Angeles, I stayed there to be able to serve the inner city because of the need. Due to the lifestyle, due to the amount of stress that most of the population in Los Angeles experiences, I actually have gone through this experience. Hence, I ended up in Guam, thank God, with family. But it's quite a devastating illness, and thank God that I'm here, and I can say that I'm alive because of my belief in high power, and also because I'm with my family here, and thank God I'm here in Guam. But I was asked to do some missions in Hollywood, but to see the devastation in LA, that a lot of professionals, a lot of the military are actually homeless, seeing veterans out on the street in wheelchairs because of either depression or sickness or what have you. But I do believe mainly because it was depression and the stress that they have experienced. So I am an advocate for your program. I went to the class yesterday that they had for the medical doctors, as well as the seminars, which I'll be attending until Thursday. I want to thank you for your dedication to this, and I agree that there should be a huge paradigm shift. Medications are not enough, and just us as a community to be able to reach out to others and to provide hope, prayer, and love, because the devastation is just out of control. It's enormous. So we just want to thank you, and hopefully you'll be able to have avail of the educational program that you'll be having in May. Thank you so much.
Well, thank you very much, and appreciate your comments, and they are very very true and very accurate. Well, it's been a privilege for me to present here in this legislative hearing. I certainly hope it's helpful to those that have been here and those that watch afterwards, the video here. And if there's any questions we can answer for you afterwards, you could get in touch with us at drnedley.com, and we'd be glad to interact with you and see what we can do to be of help to this great U.S. territory that sometimes is the neglected U.S. territory. So thank you very much. Senator?
Again, I want to thank Doc for your presentation today. As you know, we have our partners from the insurance industry here. We have our providers that are here as well. There's really our problem on Guam. We have limited services for mental health. The provider side and also the access to it. And so when we have programs like this that are available that work and could be really something that is beneficial to us on the finance side, we'll, as from my office, you have my commitment to work with SDA, who had helped put this together, to see how we can explore this further, not just with the private insurance companies, but also our public programs, the Medicaid program and the MIP. I think we have to look at other ways. As you said, we have to make that paradigm shift. I believe in that, and so we'll work, in getting to that place where we should. I want to give anyone else an opportunity. I don't know if Mr. Campillo, would you like to have an opportunity, or anyone else an opportunity to speak? Maybe Carmen, would you have a few words from SDA, or? Ma'am, please, before we close.
Hi, my name is Sandra McKeever. I run Asia Pacific Financial. We're an investment firm. And as an employer, I had to deal with a lot of employees that was going through some major depression and anxiety. And I think as employers, it really affects our work, especially we're a company of about 20, and a lot of times the treatments they're getting, it doesn't help a bit. And so I as an employer would really like to see something like this in place in Guam. I think it's going to help. Because we're all a small island community, and I think if with the success rates of what I've heard through this program, I think it's going to help not just individuals but employers, because I think the productivity and that it will, because in this really really affects workers and their productivity level. And I think if we can get more productive employees, I think it's going to help Guam significantly. And that's all I wanted to say. Thank you.
Thank you, and I agree when Doc, when you're presenting about the loss in productive time because of depression and anxiety, I see it. I see it as well, just by the constituents we see and the people we deal with. We know that this is a very big problem, and so for me, I'm very much interested to help move this forward. If this is an alternative that we can really ensure that can help us. So I know that Frank, he's always very involved. He's listening. I know he's going to get more information to see how we can move this forward, at least from that industry standpoint. So thank you. Yes, ma'am.
Senator, you know that I'm an advocate for children's mental health, and so to me, it's really exciting to think about that parents could be educated in this way, and that children could get help as well, and that they could grow up to be productive adults.
Thank you. Yes, Doc, please.
I'm Dr. James Nozaki, Medical Director at the Guam Seventh-day Adventist Clinic, and We're very happy to have sponsored getting Dr. Nedley out here, and we really would like to work with the Gov Guam and just the people of Guam to do what we can, our part, to help the mental health issues that are here on Guam. So again, we want to work with Dr. Nedley, we want to work with the Gov Guam, and we want to do insurances. Do what we can. We can't do everything, but I think if we work together, we can get a lot accomplished. Thank you very much.
Thank you very much. Anyone else have anything? If not, I want to thank you all for being here today. Thank Dr. Nedley, SDA, for sponsoring his presentation today. I want to thank all of you for coming, and have a great day, and God bless. Thank you.